Yeah, I think that's fine, Uma.
Yeah, we're live, so I think.
Yeah. Shall we start? It's 5 people have signed up.
There's still a minute to 6, Sheela, so we can start at 6.
Wait for a few minutes. Yeah. I think everybody takes their own time. This takes a hell of a lot of getting used to, I tell you, technology.
No, at least here it's a conversation. I know for a fact that I'm interacting with you. When it's a solo lecture kind of a thing on these webinars, it's very bizarre because you have no idea who's listening, what their reactions are. You can't tell a joke. It's,
Yeah.
Interesting.
Yeah. This morning I was in full panic mode because I didn't know if it would. It said something about I thought I had to co-host you, and it said you can't co-host, and so I was like, oh my god, now what?
That's okay. We're here and we're on and we're live. So yeah. So I think we should just get started.
Okay. So, hello everyone. Thank you for signing in to Zoom and whoever's on Facebook. It's going to be a very interesting session with my dear friend and colleague, Uma. Dr. Uma is a consultant on GYN at Sitapati Medical Center in Chennai, and we go back a long way. We study together in Madras Medical College. So today, with our combined obstetric and gynec experience of 5 decades, Uma, can you believe that? We just
that makes.
I wanted to stress on that. So we're kind of trying to touch upon a topic which seems to be very not just concerning for us, but also popular amongst amongst everybody, amongst the lay people. And Uma and I were discussing how it's become almost a social media trend to talk about PCOS and PCOD and PCOS. There are groups around PCOS. There are organizations around PCOS. Some of them, of course, are extremely doing extremely well and legitimate. But it also raises some concerns, which we will discuss through our conversation. So, Uma, and those of you who don't know me, I'm Dr. Sheela Nambiar. I'm also an obstetrician gynecologist, and I'm also a lifestyle medicine physician. So, I'll be bringing in some aspects of lifestyle into the conversation. So, Uma, just to get started, how many approximately? I mean, we know the incidence is about 10%. So would you say that the number of PCOs have increased in your practice, from the time you started to now, and how is it looking for you? Your patient profile is mainly urban. Am I right?
Yeah. So certainly, our patient profile in the hospital is urban, and I guess that will contrast with yours because it's a different clientele that. I mean, obviously, you have the urban clientele as well, but in your practice, you see more semi-urban.
Yeah, semi-urban, rural, a lot of rural too, rural, semi. Yeah.
So compared to when I started practice, definitely the number of women, young girls, women who seek help or who come because their cycles are irregular, because they're not getting their periods regularly, has gone up. And I think clearly that is linked to lifestyle. It's linked to also the fact that we are seeing issues with with weight, issues with stress, whether it's school or work. So I think all of that is linked, and I'm sure we'll touch upon it as the conversation goes on and questions come. But yes, we are seeing a far more number have uh, definitely have irregular cycles. Whether they all have PCOS is a different question.
Sorry.
And yeah, so how is it with you?
Yeah, I mean, I agree the numbers have gone up considerably because I don't even remember seeing, hardly any PCOS when I came in here. And, from our college days, it was just a syndrome that we read about. It wasn't something that was so commonly seen in day to day practice. But today, literally every third gynec patient is. PCOS. But like you said, many of them come with the diagnosis of PCOS. They come saying we have PCOS, we've been diagnosed, and the question arises: is it really PCOS? So if we look at diagnosis, Uma, can you just explain? Um, can you explain? Can we go off the video, please? Can everybody turn off the videos and mute themselves? Thank you. Uma, can you just tell us about the diagnosis? How do we go about the diagnosis of PCOS?
Yeah, so there are set criteria by which we diagnose PCOS, but in to put it in simple terms, we need to have one of three factors. We need to have irregular periods. Irregular periods clearly is one part of the syndrome. There needs to be some evidence that there is increased male hormone or androgen in the body, and so this or ultrasound image of the ovaries should suggest that the ovaries are polycystic. Now, as you said, there are situations where people have come in and said, "Doc, I have PCOS," and after that, and sometimes it is self-diagnosed because they've Googled and they. Sometimes it's because somebody has told them, a physician or a doctor has told them that they have PCOD, and which may not necessarily be correct. The point I want to make is that in about 10 to 15% of women who have a ovary looking polycystic on ultrasound, it may be normal. So it has to be put together with the whole other symptoms for us to say this is what it is, because the syndrome has long-term consequences. It's not just about periods. And so we need to make sure there are no other reasons why this woman or young girl is not getting her periods regularly.
Yeah. Yeah, and the other thing that I found with people who come with these diagnosis of PCOS is that the concern seems to be mainly the periods.
Yeah.
Especially the parents. That the period hasn't come, and so can you give us some medication to get the periods to come? And frankly, that's the easiest thing, isn't it? That's the easiest thing to sort out, just to give them a hormonal withdrawal. But
Yes.
concerning is that many people, rather most people, don't really understand the long-term sequelae to polycystic ovaries, right? So can we go through some of the long-term problems that women can face, which are far more serious than the periods just not coming?
Yeah, most certainly. But before we do that, Sheila, do you want to just touch upon the fact that, yes, the irregularity in the period is because in these women, when there is a hormonal imbalance, ovulation is not happening properly.
Yes. Yes.
The commonest question when people ask, or the concern is, we've done our hormone test, you're
Yes.
telling me your thyroid is normal, your prolactin is normal, your hormone levels are normal. Then what is this imbalance that you're talking about?
Mm-hmm.
And then we need to explain to them about insulin resistance, and that is the crux of having a polycystic ovarian disease. So, Sheila, do you want to talk a little bit about insulin resistance and what it does because I think then it leads into what the long-term concerns are and how we actually tackle this problem.
Yeah, certainly. So, insulin resistance is a condition where your body has enough or even more insulin, but that insulin is not, or rather, your cells are not receptive to the insulin, and therefore your blood sugars may not be in control. But if it's in the early stages of insulin resistance, your blood sugars may still be in control, but you will find that as you age and as you go along, this can lead to diabetes and a whole lot of other diseases, including cardiac disease, including many pro-inflammatory diseases. So the insulin resistance has actually been said to be the cause of several problems. So, since the real problem, or rather, can we mute, can everybody mute?
Sheila, can you please mute your mics, please? Sheila, you may have the mute option.
I've just muted it. Yeah. This person keeps unmuting herself. Yeah. So insulin resistance is the real problem. Earlier, we used to do FSH, LH, and show the ratios being abnormal, but we don't really need to do that now, do we? It's primarily insulin resistance that we are concerned about.
Yes, and we don't need to go and do insulin levels either. I think there was a phase maybe
Yeah.
8-9 years ago when it was, a lot of people were routinely checking insulin levels.
Yeah.
And we do check sugars, but we don't need to check insulin levels to make a diagnosis.
Yeah.
So a lot of the tests are done more to ensure that as a baseline, there aren't other factors which can be contributed to because of the baseline insulin resistance, such as diabetes, such as a tendency to high blood pressure, and high cholesterol or lipids. So these are the things that we check for in somebody who has PCOS, because we want to make sure that these things are not already there.
Yeah.
And then we can go about how to deal with the problem.
Yeah. See, the one thing that comes up, Uma, is that we talk about insulin resistance, but many of the patients say, "But my sugars are normal, currently normal."
Yes.
So they don't seem to understand that this is like a pre-diabetic state where it may not necessarily be abnormal today, but you can lead to an abnormality later, and of course, it can lead to other problems of insulin resistance.
So insulin, because to be honest, even when in the first few years of college, our understanding of insulin was to do with glucose metabolism, right?
Yeah.
So we link insulin with sugars, but insulin has other roles, and one of it is ovulation. So what happens in PCOS is in women who have insulin resistance, that part of that action of insulin on the ovaries to ensure that the hormone cycling is happening in such a way that ovulation happens every month is what is affected, and that's the reason correcting insulin resistance is the crux of the problem and the solution to polycystic ovary. As Sheela said, it's very easy for us to give tablets to induce a period. And here again, there is a lot of apprehension of women who keep asking, you're giving me hormone medication. Isn't that bad for me? Now, everything in our body is run because of hormones. So if you're ovulating every month, it's because estrogen and progesterone are cycling in a set fashion to give the normal monthly period. So if you're not ovulating, then the body is not producing progesterone, and therefore we give progesterone to ensure that there's a withdrawal, or we can give a 21-day pill to ensure that the period comes. So this is easy to do, but this is only treating a symptom, which is irregular period. It is not addressing the problem, which is the slightly higher male hormone and the fact that insulin is not working. And this is what makes PCO harder to treat, because there has to be buy-in from the individual and a willingness to address this increased insulin resistance, because that can be done not just by medication. Medications do play some role,
Yeah.
but largely it becomes a lifestyle issue,
Yeah. So
isn't it?
when do you think it is appropriate to start with, let's say, metformin? Um,
Personally, I don't use that as first line. So,
mhm,
metformin is a medication which helps improve the sensitivity to insulin in the body.
mhm,
And because it improves insulin sensitivity, it can help with regularizing the cycle and improving the situation in PCOS.
mhm.
Metformin is a very common drug used for the management of diabetes.
Yeah.
Okay. Now, but uh, so it depends on what it is that we want to achieve. What we want to achieve is to reduce insulin resistance, increase insulin sensitivity. Medicine such as metformin is one way of doing it. Is there an alternate way of doing it? Yes, there is, and that is essentially weight management, exercise,
Yeah.
and activating your muscle with exercise, which will help. Now, the advantage of the latter is that it can help sustain the improvement and correct the baseline problem without needing the additional medication.
Yeah.
The, isn't it?
Yeah, yeah, I agree. Before we go into that lifestyle management, Umak, also like to specify that when the patient is coming for infertility, the treatment may be slightly different in the sense you start to manage the infertility aspect of it much earlier than when a patient just comes saying irregular periods, go into
Hmm.
the hormone medication, etc. Of course, lifestyle is it's standard across the board, but when they are in a hurry to get pregnant, for instance, if a woman comes in her mid 30s and she has polycystic ovaries, and she wants to get pregnant,
Mhm.
so while you're managing her
Yeah,
weight wise and encouraging her to get her lifestyle in order, we're also trying to help her conceive. So that's a
very
different,
true.
yeah, that's
Very
a
true, very true. Now, again, but Sheila, as you will agree, there is very good data that if we achieve weight loss, which can be even 5%
yeah,
of your weight, if of your body weight, if you lose, or and definitely 10%, then the chances that you will conceive on your own without medication or
that's
treatment is higher.
yeah,
And your even if you need medication, the amount of medication that you need to ovulate
yes,
is lower. And
yes,
most importantly for me, when you start off pregnancy with a slightly lower weight, your chance of diabetes and blood pressure in pregnancy is low. So for
absolutely,
all these reasons, I do tend to push women to
yeah,
try and achieve that little bit of a loss. Even
absolutely,
if they don't lose, get into that mode of being conscious about what it is that they need to do
yeah,
while we start treatment with giving medicines, checking ovulation, etc., and helping them get
yeah.
pregnant.
And
Unfortunately, it's a very challenging thing to do
it,
because for a lot of people, the quick fix is, give me the medicines, get me to ovulate.
yeah,
I don't want to waste time. And
yeah,
we've had women who go and come back after 6 months and are actually heavier.
yeah,
So, so that's a type, a, a tough one to cross, but it's important that even there it helps, isn't it?
yeah,
That's why I said it first. But
yeah.
I agree that there we are, the challenges are slightly different. Yes.
Yeah, and also maybe stressing to these people that when they conceive with PCOD, their chances of various other, besides diabetes and an excess weight gain, things like even abortions, preterm labor, preeclampsia, all of these go up.
Yeah.
So they are better off reducing their weight even by 5 to 10%, as you said, and starting off a healthier lifestyle by eating better, by exercising regularly, because these things play an important role even in your pregnancy. For you to have a healthier pregnancy, healthier fetus, all of that, it plays a very important role. So it's not just about conceiving, but also going through the pregnancy in a healthier way. So going back to a regular a patient who is, now we are advising lifestyle management. So we have diet, we have exercise. So some of the studies are, talking about how a patient with PCOS has that much, it does find it more difficult to actually lose the weight,
Yeah,
and so there is a real challenge there, because not only are they more stressed because the weight is not going off, and they have the other challenges of wanting to conceive. So how do we address this issue? How do we counsel them? How do we talk to them about, despite the fact that it's not as easy as for a regular person, what are we to do?
mm,
What would you suggest? I mean, as far as I'm concerned, Numa, I think a lot of it has to do with the motivation, wouldn't you say? Talking to the patient about the importance of it, putting her onto the right people to train her, keep her motivated, because the main problem I see is when they don't achieve that weight loss in the period that they think they need to achieve it, they tend to stop. But consistency is the key, because we know that maybe you don't lose it in the first 1 month or even the first 2 months, but when you persist, you start to get you start to understand that it's more than weight loss. And we know that even for PCOS management, just the exercise itself seems to help.
yeah, certainly. I think it requires actually more than the 15-20 minutes that they will get with us in a clinic consultation.
Yeah.
It requires somebody to guide them with the diet. It requires someone to kind of, watch them, because it's the combination of diet and exercise, but somebody needs to handhold them through the process
Yeah.
and motivate them. And with and if they are committed, we've had quite a few women who are quite committed, who
Mhm.
have the buy-in, who are willing.
Mhm.
And equally, we have some where they're not,
Right.
happy to put in the effort that is required.
Yeah.
And a supportive spouse, especially in the context of fertility, or a
Yeah.
supportive parent. Sometimes it's in the family, if everybody has had irregular periods, if there's already diabetes, then you could have two extremes. You can have families who are extremely meticulous in particular, and you can
Mhm.
have families who have normalized this and
Mhm.
said, my aunt, my mom, my sister, they all have irregular periods, but they've all had children, so it's okay. I'll
Yeah.
also have, I won't have a problem.
Yeah.
So that normalization also is sometimes a challenge, isn't
Yeah.
it?
Yeah. Yeah.
So we have to figure out what works for whom.
Yeah. And also the parent normalization on the one hand, and the parent, for instance, or the mother, usually the mother, coming to you and telling you that the daughter needs to lose weight, she needs to get her periods, she's going to get married, she may have problems. I've heard that PCOS can lead to infertility. And the whole family setup is, it's not really encouraging of a healthy diet and a healthy lifestyle, and that makes it so much more difficult for one individual in the family to follow a healthy diet. So
Yes.
very often, trying to have the conversation with the mother and the father, and maybe whichever member of the family is willing to step in, really helps, because it has to be a joint effort, in the sense that it has to be easier for this one girl to make this lifestyle change. And of course, it's going to help everybody else as well. So there's
True.
no harm in getting them also involved. This is what I find frequently, that the mother says, my daughter is so overweight. How can you help her to lose weight? And she herself is very overweight. So it's a very difficult situation to force a young girl to not eat the fried things that are being made at home on a regular basis, for instance. So it's very challenging, especially where diet is concerned. And as far as diet is concerned, what we have found is that although a lot of Indians are vegetarian, the amount of refined carbohydrates and oil, fat in the form of either oil or ghee or butter is way more than we require. And in addition, as a result of this, the vegetables, uh, beans, seeds, fruits, etc., are much less. And I think that really is the key to the problem, because many of them say we are vegetarian, we don't eat any meat, etc. But the fat comes from the milk products, for instance, dairy. And there is a lot of research showing that dairy has an effect on insulin resistance. So right there, cutting out the dairy will help now with the IGF-1 and with reducing insulin resistance, and of course the saturated fats as well. So when I counsel regarding a diet, I usually tell them to go whole food plant based, where most of their plate needs to be with vegetables,
Vegetables.
beans, seeds, and as little, our bread cereal group is also way too much, Uma. Let's face it. You
Very
know,
true.
on a regular basis, you
True.
see this very small built village girl, and when we get their dietary call, she's eating 5 idlis in the morning, and she's eating like 3, 4 cups of rice at night in the afternoon, because they don't eat enough of the vegetable to fill them up. So the refined carb becomes the main stay of their plate, right? So like our South Indian breakfast is just idlis and a little chutney and maybe just a little bit of sambar, which is problematic, right? So I tell them add the vegetable from the previous day if you like, a cup of that, or chopped raw vegetables or some sprouts to add protein. So are you also finding this, where their ability to reduce their refined carbs is quite difficult?
It
In an
is. It is, and many times we have women say, "Oh, we don't eat rice. We only have tiffin." But what is that tiffin? It will be idli or dosa. So I think it's that education that
Right,
is that becomes important,
right.
and handholding. Uh,
Yeah,
just telling them and sending them away is certainly
that's
not
real.
enough.
Yeah,
So there is a question, Sheila, about should we exercise? Can we do exercise when you have PCOD or only diet and medication? I think from what we have spoken so far, you would have realized that exercise is very integral to this whole process. So it's diet and exercise,
yes,
and it's particularly important going forward also, because that was the question that we started and we digressed, where Sheila asked about the long-term concerns about PCOS, because again, most women come in when they have, as with everything else, I think many women's health seeking behavior is linked around their periods and their fertility.
yeah,
And once those concerns are dealt with, they really, don't worry. And even at 38 or 40, if their periods are irregular, many of them think it's menopause.
yeah,
So menopause doesn't come into play till much, much later, closer to the 50s. So um, what happens is, because this polycystic ovarian syndrome is linked with insulin resistance, you have reduced insulin sensitivity. You are at, if you have PCOS, you are at increased risk of developing diabetes. You are at increased risk of developing hypertension. And obviously, if the weight is higher, then the obesity in itself increases the risk of cardiovascular disease. So it's like having a double whammy. You are somebody who is overweight. In addition, you have insulin resistance, and that combination makes you somebody who's very prone to have these kind of health issues. The second concern is that because in this issue, in this condition, you're not ovulating every month, there is a greater exposure of the lining of the uterus or the endometrium to estrogen, and not enough withdrawal. So if your periods come every month, your progesterone is on board, and every month the lining is shed. When the period comes once in 3 months or 4 months, then for 3 to 4 months, there is prolonged estrogen acting on the lining. The lining becomes thicker and thicker until at one point there is bleeding, and that bleeding is heavy. So over a period of time, this unopposed estrogen impact on the uterus does predispose a slightly higher chance of cancer of the womb, which may not happen till the 60s and 70s, but the stage is set in the 20s and the 30s. So that is why it is important to address these issues earlier to prevent problems that happen afterwards.
Yeah.
And that is something that we are seeing a lot more of. And I don't know if you are seeing a lot more endometrial pathology in older women, Sheela, but definitely we are.
Sorry, Uma, I didn't. I was looking at. Yeah, what did you say? Sorry.
No,
And
so I said that we are starting to see a lot of endometrial pathology in older women, in their
absolutely.
late 50s and 60s,
Yeah, yeah.
coming in. And if you go back into their history, they would have had very irregular, erratic periods.
Yes, absolutely. Yeah, absolutely. So what we're trying to highlight here is that it's not just a problem of irregular periods which need to be sorted out. It is a problem that can have long-term sequelae, and the one of the primary ways of dealing with it is through lifestyle, both exercise and diet. And there was a question here asking about that exercise and diet. It's very, very important to exercise, right? Because what the research has shown, and what I have seen from my own experience with clients and patients, is that exercise does much more than just weight loss, right? Because a patient who has polycystic ovaries, in all probability, also has a higher level of stress, is depressed, and is undergoing the pressure from family, etc., to conceive, etc., right? So when you want to mitigate stress and to manage depression, one of the simplest and the most effective ways to do that is through exercise. So when you start to exercise on a regular basis, 30 minutes to 60 minutes a day, 6 days a week, you will not only find the body composition, your fat loss, all of that. However slow, it will happen, provided you're eating healthy, but you will also find that your mood starts to elevate. And I think that's really critical because, we all talk about just managing symptoms, but we also need to look at a better quality of life.
True.
And you cannot have a better quality of life if you're depressed or if you're just highly stressed, right? And one of the simplest ways to do this is through exercise, which is what I keep telling patients. And many of them say, but I hate exercise. And I completely understand that, because there is only a very small percentage of people who actually enjoy exercise, right? But let's face it, you don't always enjoy everything that you have to do every day, like making your bed and or having a shower, and we do it because we have to do it. So I think it's important to understand that this is literally something like you would clean your teeth, you would need to exercise on a regular basis. And just to touch on, Uma, the kind of exercise is also important. While cardio, which is running, walking, cycling, swimming, etc., while that's very important, um, I would like to stress that also participating in strength training to increase our muscle mass becomes very, very critical. And I think this is also very critical in PCOS, because insulin resistance is improved by building muscle mass.
Yeah, absolutely. Absolutely. And so that combination of diet, which
Yeah.
will ultimately actually mainly result in the weight loss, and the exercise to build muscle is important.
Yes.
Somebody's asked Sheela about what is a proper cycle pattern. It need not be a clockwork 30-day cycle. It may be 25 to 28 for some people. It may be 30 to 32 for some people. It's okay as long as it's coming regularly. Clearly, if we go beyond 40, 45 days, um, then your ovulation is more erratic. Uh, but if, one or two irregular cycles in a year is not PCO. I mean,
Yeah.
typically, if you have polycystic ovarian syndrome, the cycles will usually be more
Consist.
irregular and there will be other signs. Some of them can be like increased facial hair. There can be a lot of hair loss, uh, things like that.
Yeah. Yeah, so that question about what kind of exercise is, yeah,
Yes.
is, yeah. So just touching upon exercise again, one of the other things that leads to the sustainability of exercise, or for you to keep staying motivated, is progress. And when I say progress, it's not necessarily weight loss. You know, when you start to see your body improve, when you start to see yourself getting stronger, start to see that you're getting more mobile, flexible, those are the things that actually keep you motivated to continue to exercise. So weight loss by itself, which is critical, especially in a condition like PCOS, I would urge young women not to focus only on weight loss. You know, focus on the exercise, focus on a diet that is healthy, that is primarily plants. If you eat meat, then keep it to the minimum as far as you can. Keep the pro-inflammatory products like your dairy and meat to the minimum, and your protein, which can come from plants, which is beans, your hundreds of varieties of dals, seeds, nuts, etc. That should be your source of protein. People have asked about milk intake in pregnancy, Uma, because I just said that milk is pro-inflammatory. Can you avoid milk in pregnancy? Um, there is research that shows that you can, that you don't necessarily need to drink milk in pregnancy, right? You can have other sources of like plant milks in pregnancy. Calcium supplement is given. um, the interesting thing is that, in those countries that drink the least amount of milk, which is the Far East, they actually have the least amount of fractures and osteoporosis. So this whole thing about osteoporosis and fractures being prevented by milk is not necessarily true. Some of it may be propagated by the dairy industry itself. So we need to use that information with caution. We do know that using when I say a whole food plant based diet, I mean a whole food plant based diet, not necessarily a vegan diet, because there's a lot of difference between the two. When you say vegan, you're actually saying what you don't eat. You don't eat animal products, including meat, including dairy, but you don't say what you eat, which means, for instance, French fries are vegan, but they're not necessarily healthy. So when you say a whole food plant based diet, you're focusing on what you do eat, which is foods that are whole, not refined, and primarily plant based. So that's the difference between the two, and that's what I advise patients with PCOD, etc., to try and implement.
So, I mean, the issue is that some amount of calcium intake is necessary, and if you are not getting it from milk, you have to consciously include foods that will give you the calcium. If you do neither, then you're in trouble.
Yeah.
So, to that extent, you need to be conscious, and we do tell people what are the alternate sources of calcium and how much they should include in their diet.
That's,
And a lot of hand holding is necessary, and that we've realized in the clinic.
yeah.
As I told you, we've had extremely good results when there is buy-in and when there is commitment.
Yeah, yeah, absolutely. So that's the thing about this Indian vegetarian diet, Uma. I find that most people, they stick with just one or two vegetables which they like, and they continue eating that and only that, and that to very small quantities. So then you are bound to be nutritionally deficient, right? Because you're not getting you will get a wide variety of nutrients only if you eat a wide variety of nutritious food, right? If you're filling yourself up with white rice, lots of idlis, dosas, you're not going to get the nutrition that you require. And if you eat a lot of that, you're not likely to be able to eat more of the vegetables because you just can't. It's physically not possible to eat the whole lot of rice as well as the vegetables. So, which is why the stress needs to be on reducing the quantities of the refined foods to the absolute minimum and increase the amount of vegetables. A lot of my pregnant patients are able to, because some most of the time you see them in pregnancy. I'm not talking about PCO patients here. I'm just saying in pregnancy, when you ask them to change their diet and, with the hand holding that you're talking about, they are able to do it. Even those women who are used to eating large quantities of rice and, tiffin, as you say, they're able to do it when they understand the necessity for it.
Oh, absolutely. And when we have somebody who has done it talk to someone who is not
Yes,
convinced or who's struggling, then that becomes a motivating factor because they
yeah.
realize that it can be done.
Yeah, I think
Um,
these support groups on social media are trying to do, Uma. I was talking to you earlier today about, PCOS and PCOD being such a popular. In fact, I was told it was trending and it was, a very popular hashtag, and it concerns me that it's actually a really serious problem.
Very true. I mean, there's a lot of information out there which can be very, which could really be there an individual's belief. It need not necessarily be strongly supported by
Science.
evidence,
Yeah,
and uh, and because of the implications
yeah,
beyond pregnancy, beyond fertility,
yeah,
for women with PCO, uh,
yeah,
be it mainly cardiovascular. And in India, the non-communicable diseases or NCDs, as we call them, is booming. And we see it. We see so many women who have diabetes in pregnancy. You go back and you'll see that a lot of them have had very irregular periods,
absolutely.
and but they don't. They stop worrying about it after they get pregnant and have their babies, and then suddenly they're surprised when or there's a very rude shock that comes when they have their heart attack or they have very high sugars, when actually the wake up call should have happened a long time ago. So maybe as physicians our responsibility is also to highlight this long term
Yeah,
impact of this condition.
yeah,
uh, and sometimes, especially for women, they don't necessarily go for regular checkups,
yeah,
or after the fertility concerns are
yeah,
kind of handled. So I think it's important to give this message that you need to continue to take care of yourself, because if you have significant medical problems in your late 50s and early 60s, you still have about 20-25 years of your life to get through, which you want to get through in a healthy fashion, isn't it?
yeah, yeah. Yeah, there was a question here about, I just saw it.
Keto diet.
The weight loss keto diet, is it healthy? Okay, so again, it depends on what kind of a keto diet. There are different kinds of keto diets where some of them are focused only on animal proteins. And again, I've stressed that animal proteins are definitely pro-inflammatory. So I would not go there. And there's not enough long-term evidence on keto diet from animal protein being beneficial. Yes, they are showing sugars being controlled, they're showing weight loss, but the long-term consequences and sequelae of an high animal protein diet is, I mean, there is evidence that it's inflammatory. There's no question about it. So I wouldn't do that. I wouldn't do an animal protein keto. The other form of keto is where you eat mainly, things like avocados and leafy vegetables, where your body tends to go into a ketogenic state. But there are other ways of doing that, such as intermittent fasting. Intermittent fasting can also put you in a ketogenic state. And of course, that has to be done under guidance. You can't just start your intermittent fasting without some amount of help, especially if you are diabetic. So please be careful of that. Um, but there is enough science to show that intermittent fasting also, because of the fact that you are not eating for a long period of time, maybe 14 to 16 hours, seems to improve insulin sensitivity. So therefore reducing insulin resistance. So it is good for PCOS as well.
PCOS.
Yeah, but again,
But as with a lot of these keto and other diets, they're not sustainable, and that's what we find.
yeah,
Many women have come and said, "Oh, we've lost weight on keto," but
yeah,
you go off the keto, and
yeah,
you haven't backed it up with exercise that can sustain it.
yeah,
Um, it's going to seesaw
and
back. So I think it's important that weight loss, yes, diets are one part of the story,
yes,
but we need to have a more holistic approach to how we are going to address this, especially, I mean, in everybody, but all the more in women who have PCOS.
absolutely.
And it has to be something in younger women and women who are contemplating fertility. It has to be something that can be sustained through pregnancy as well.
Absolutely.
So I think these are key points that we need to keep in mind. So any very, what should I say, any diet which is very extreme
Yes,
is not going to be sustainable. You may use it to kickstart your weight loss, but you
yes,
must have a strategy in place. What are you going to do to sustain it after the kickstart weight loss gives you the motivation to continue?
yes. There is one question.
And sorry, yeah.
One question: vitamin D deficiency and its link with PCOS.
So so vitamin D deficiency is very, very common.
Yeah,
And there is information that if you look at some of the studies, they say nearly 80% of people who have been screened have low vitamin D.
shit.
Then the question is, if 80% have low vitamin D, is it a deficiency?
Problem at
Uh,
all.
is it a problem at all? But there is some data that low vitamin D over a consistent period is associated with insulin resistance. It is associated with diabetes, and correcting the vitamin D does help this issue. So um,
Yeah, a supplement with vitamin D and sunlight. you know Sunlight, but yeah, exposure to sunlight is a bit of a problem in most places, I think, where you need to expose arms and legs. But I think some amount of sunlight exposure is important for mood, for sleep, and of course for vitamin D. And Indians, because of our skin, because of the melanin in our skin, even if we are exposed to sunlight, our ability to produce vitamin D is diminished. So you may still need to take a vitamin D
some
supplement,
supplement.
which is very simple and easy to take, so shouldn't be a problem. Yeah.
And
So
the other issue, Sheila, is mood, which we did briefly touch upon. But there is good data that in women who have PCO, there is an impact on mood, and you can actually see some depression,
yes, absolutely.
which also is something that is extremely important to address.
Yeah.
And since stress, I mean, today everything is linked to stress. Uh, and I think in the COVID situation, stress has increased tremendously all around for various reasons.
Yeah. Yeah.
But we see stress impact periods very, very classically in the younger girls, classic 12th standard missed periods, mother bringing the daughter. It's almost a given,
Yeah.
today. And then with jobs, with relationships, with so many things, it could be personal, professional. The stress certainly has a role to play, but again, this is something that needs addressing, and there is probably a greater acceptance of acknowledging the need to handle mood now. But especially in older women, I find there's a lot of reluctance to address mood.
Absolutely.
Uh,
Absolutely. Yeah, I agree, Uma, about women not being able to talk about, having a low mood, and even understanding that it needs to be treated. They seem to they seem to accept it as part of their life, which is really
yeah,
tragic, because you know that it's treatable. That there are ways in which they can lead a better quality life, and that's what I think is really sad about this, the whole, whether it's PCOS or otherwise. um,
that's true.
It's very treatable, and it is easily manageable if you follow the well, it may not be easy, but it's at least we know that it works. While antidepressants
Certainly.
do work, we know that lifestyle measures work. But the only difference is that lifestyle measures, it's not as easy as just popping an antidepressant. You actually have to go out and do something. So I think that makes all the difference, right? The one thing that we need to stress, Uma, is that even though PCOS is a problem, like we said, very popular, social media and all of that, we can't just focus on just that one problem and treat just the symptom. When you start to treat the whole woman and the whole person, you understand that diet and exercise and stress management and sleeping well, good quality sleep is a standard. It's a standard prescription for everybody. So we don't need to say, for instance, this particular exercise will suit a PCOS patient. I've seen that a lot where, they say things like, I've read things like, this exercise will actually massage your ovaries and help in PCOS.
There isn't one such quick fix, unfortunately.
Yeah,
Yeah. So
yeah. So,
no, but yeah, I mean, reiterating the fact that there has to be a commitment to this for life. For
mhm,
so, which is why making that diagnosis is extremely important. If
yeah,
there is clearly PCO, then it is something that the woman has to internalize and work for with life for life.
absolutely, absolutely. Somebody's dog is barking. Just muting it. Yeah. So, ma'am, is metformin required to be continued in pregnancy? Uma, you want to take that?
Metformin need not be continued in. Also, metformin, when it depends on what metformin is given for. There are women with PCO who actually have elevated sugars, in which case metformin is continued. But if metformin is given essentially to help ovulation and the sugars are normal, then usually once we document that there is a viable pregnancy, by which I mean that we see a heartbeat around 8 weeks or max by 12 weeks, it is advisable to go off the metformin. There is no benefit to continuing that metformin right through pregnancy.
Hmm.
However, somebody who has insulin resistance and has PCO is at a higher risk of developing gestational diabetes. So, so it's important to keep monitoring the sugars, and if the sugars start to go high and cannot be brought under control with just diet and exercise, then some medication may be necessary.
Yeah. So there's another question.
So continuing the metformin through pregnancy does not reduce the chance that your sugars will go up. So it's not doesn't have a preventive role. That's what I was trying to say.
There's another question. Is
Sorry.
yoga helpful? Yes, certainly. Yoga is helpful. Yoga is helpful in many ways. One is that it acts as a very good stress reliever because of just the way and the process of it, and the mind body connect as well as the breathing. So it acts as a great stress reliever. And of course, when done properly, it improves flexibility. And depending on the kind of yoga you do, it can also improve strength to a large extent. So yes, yoga is very helpful.
There's a
Um,
question on FB, Sheela, about can you talk to us about lean PCOS? So yes, all women who have PCO need not be obese. So you can have irregular periods. You can have insulin resistance even without being obese or overweight. So in women who have lean PCOS, the solutions or the saying lose weight may not be part of the prescription because they really are not overweight or obese. But the fact remains that there is a degree of insulin resistance even in these women. So, therefore, we may have to opt to medicines like metformin. And I do encourage these women to exercise because they are activating muscle And we do know that, especially as South Asians, for the same weight, we have more body fat than muscle. And therefore, while diet, they need not go on these extreme diets to lose weight. It's important that they exercise, because by that they're activating muscle, building muscle, increasing the metabolic activity, and therefore addressing insulin resistance. So in a lean PCO, the challenges, are slightly different, but the concerns remain to be the same.
Yeah.
Any, am I right, Sheila?
Yeah, absolutely. So, like I said, if you don't defocus from weight in a lean PCOS, defocus from weight to the exercise per se, because exercise by itself helps the PCOS. So, it's not necessarily about the weight. So, you can manage your weight using an appropriate diet for a lean PCOS, but as exercise is essential. Somebody's said, I'm sorry, somebody asked, is Surya Namaskar helpful? Yeah, definitely it is, because it's one of the vinyasas of yoga. So Surya Namaskar will help. Can OCPs
OCP.
become a temporary solution for regularizing periods and achieving pregnancy? No, OCPs will prevent pregnancy. So you can't achieve pregnancy with OCPs.
But
Uh,
you can regularize the period with OCP, certainly.
yes,
Uh, there are some people who believe, Sheila, that if they take the pill for a period of time and they stop, they'll start ovulating. So I don't know if that's what this question is about, but it doesn't always work that way. The pill is given to suppress ovulation for a period of time. We use it sometimes in women who have very irregular periods, who forget or who are not happy to take just progesterone.
yeah.
But that's not that. It's not like a kickstart, and then the body will ovulate, and
Yeah.
you can get pregnant if you have PCO. Yeah.
You can't get away from the fact that lifestyle is the bottom line. I mean, you can't get away from that. So regularizing your periods is just a symptomatic management. You have to uh, eat clean and exercise, sleep well, manage your stress in order for the whole puzzle to fall into place. So,
So there's a question about the role of fasting in PCO.
yeah.
Um,
I just talked about intermittent fasting.
Intermittent fasting. Yeah.
That is, it does reduce your insulin levels and improve insulin sensitivity. So yes, it is helpful in PCOS. Definitely, when you start intermittent fasting, you do need to be guided. So take professional help when you're doing the intermittent fast. Can walking 1 hour per day, exercise 30 minutes per day, and having a healthy diet improve fertility? Yes, most certainly. What should be improved? Should we avoid junk food? There's no question about that. Should we avoid? Should we avoid?
Yeah, that's, asking Sheila, especially that question is like, I know the answer. No, but certainly, yes. I think it's important to take this opportunity to emphasize that exercise does not harm pregnancy.
Yes,
Exercise can be continued through pregnancy, and you can exercise even when you're trying to get pregnant, because
yes,
these are very, very popular myths
yes, absolutely.
that people have, irrespective of PCO or not. They think they shouldn't exercise if they're trying for a pregnancy. And when you talk about walking for an hour, so this is interesting. We asked people in our clinic. We just randomly asked 50 people, have they ever exercised before? Nearly 80% said no. The people who said they've exercised, what was their exercise? It was walking. And
Mhm.
how long? Half an hour. So the question is, how much or how far are you walking in half an hour?
Distance.
Will be
Yeah,
the
yeah,
next question that we have to ask.
yeah.
So these are things that I have learned over time, and actually, as my own journey with exercise has strengthened, I am learning to ask the more vital questions,
Yeah,
because. But I realize that this takes time.
yeah,
It certainly takes time,
yeah,
and it helps to have a team if who can support this if we can't do it ourselves,
yeah,
um, or if you have, like Sheila does, the understanding and the expertise with lifestyle medicine, then she will say that her consults will not be 15-20 minutes, they will be 45 minutes to an hour. So
Yeah,
if you don't have that kind of time, you need to have a supportive team, and you have to build that team in
yeah.
practice to
I
be
still
able to
have,
deliver.
I mean, I do have a team too, Uma, because end of the day, I find that even a diet consult, the initial consult, is not sufficient. You
Yeah,
need, person needs to come back to talk to, whether it's one of my trained nurses or the diet supervisor. They need to be in frequent touch, and you don't have the time for that frequent touch. So that's very, very important, that
yeah,
the patient comes back and touches base to,
absolutely.
identify and troubleshoot, because it's only when you actually start implementing the diet that you realize there are things that you're not able to do or you have doubts about, so you
Yeah.
need to be able to clarify those doubts. Yeah,
Yeah, very true. So when they call back and you have somebody who guides them through, it works. And then equally, I've had women who have come back and said, yes, you did guide me to meet Rekha. She kind of told me what to do. I had some issues. I never got back to her. And you're like, why? So, like, if I gave you a medicine and it didn't work, you would get back to me, isn't it? So I think that that shift has to happen for these things to fall into place.
yeah.
Yeah,
Yeah, that's the thing, Uma. I think that you're right. You're very right, because when you give a course of antibiotics, most people do tend to finish the course. They take it regularly, and But when it's exercise and diet, which is essentially a part of the prescription, somehow that seems to get just fall by the wayside. So it's important to know that that's very much a part of the prescription, especially for a PCOD patient. So please don't neglect that aspect of it and only take the medication. Even if you're taking medication, exercise and diet has to feature. So this person is asked about volume of the ovaries, Uma. I'm not sure if that's really too, you don't need to be obsessed about volume of the ovaries to,
that's something that we have to use as physicians and
yeah,
sonologists to stick that label.
yeah.
But I don't think that it's not as if the volume of the ovary will change and we are monitoring that to see whether PCO is getting better. So I don't think we need to worry about it. Yeah.
So is it completely curable? Somebody has asked. Well, if you implement the right lifestyle changes, I think it is definitely reversible, but it takes a lot of consistency. It takes a lot of consistency. It takes a lot of motivation. But then people like Uma, myself, and I think several other gynecologists are providing this kind of support for patients. But you all have to reach out to us, because there's only that much one can do in terms of providing the support. You have to get back and stay consistent with the with staying in touch with your physician or your gynecologist. So yeah,
Yeah.
so it's way
I think,
past an hour of
yes. Yeah. Eh,
talking
I
now.
think PCO is one of those things that we can keep talking about, but I think we
Yes.
should wrap it up and then,
Yeah, thank you so much, so very much for coming. And as usual, when we start talking, it's like, it just goes on and on. So we can, so we can do more of these on different topics. Thank you so much, Uma. And thank you everybody for, signing in, and those of you on Facebook who've signed in and are watching from Facebook. We can answer those questions, I think, later. Yeah. So thank you,
I
everyone. And
thank you very much. Thanks, Sheila, for the opportunity, and thanks everyone for joining.
most
Thank you.
welcome. Bye bye.
Bye.